What we're going to do today is just talk very briefly about the activity. We'll go through some objectives, and then I've outlined a few slides which actually cover more of the pharmacy-based content or knowledge application of these stations. The reason that I want to do that is so that when you come to lab, you can really focus on engaging with the patient, listening, motivational interviewing, communicating, etc. And that clinical information that comes more naturally to us can just kind of be in the background. Of course, that's our primary focus, is the safety of our patients, but I want you to really feel like you have a good grasp on some of that content so you can really focus on some of the attitudes that are being presented to you.
During lab this week, you'll be providing information to and the objectives this week are pretty straightforward, but I really want you to take a look at them. I want you to be able to assess whether a patient is an appropriate candidate for self-care and offer appropriate OTC recommendations and counseling. You'll be taking the information that you've learned with Dr. Wilhelm and applying it to a patient case with an actual acting patient. You'll provide patient counseling on various specialty medications. You'll be providing counseling on Humira, other injectable medications, taper up and taper down doses. So this is your opportunity to take that level of counseling that you've built upon and take it to a next level. You'll be completing a medication reconciliation for a patient who's currently in the emergency room and about to be admitted. You'll enter a patient room to provide discharge counseling and educate a patient on a new medication they will be starting upon discharge. Some things to remember when you enter a room: knock on the door, introduce yourself, foam in, foam out. If there's someone else in the room with the patient, like a family member, ask if it's appropriate to discuss information with that person present. Remember, HIPAA is key. Confidently and accurately answer patient questions regarding generally pharmacy information. So there will be times where the patient will be asking you questions and you don't have a lot of information to go on. You need to gather information. You need to appropriately recommend answers to their questions. And then I also want you to be able to serve as a patient advocate and communicate actively with a provider.
Let's talk a little bit about OTC recommendations. So I'd highly suggest that you refresh yourself on that Quest Scholar MAC process. So Quest Scholar is our process of how do we determine if a patient is appropriate self-care candidate, what types of things do we ask the patient to gather appropriate information to make an appropriate recommendation, and then how do we counsel the patient with that medication. So please review from Dr. Wilhelm that Quest Scholar MAC process and what types of information you need to ask the patient to gather information about what recommendation you should make, and then also what should you talk to the patient about. So for example, for the Quest, quickly and accurately assess the patient, establish that the patient is a self-care candidate, suggest appropriate self-care strategies, and then talk with the patient. These things should include mechanism of action, administration of the medication, adverse effects and how to manage them, what to expect from the treatment, and appropriate follow-up. For Scholar, that stands for what are the patient's symptoms, what are the characteristics, what's the history been like, what was the onset, what's the location, what are aggravating factors, and what are those remitting factors. So please review your information so that you're prepared to make those OTC recommendations. For OTC recommendations, always remember to ask the patient what their current medications are, if they have any allergies, and if they have any diagnoses or current disease states. After you've made a recommendation, always remember to include non-pharmacologic recommendations as well. So for example, if the patient is experiencing seasonal allergies, we could also suggest that they close their windows, that they use a soft washcloth to wipe out their eyes before bedtime, and that they use nasal saline. So for that OTC counseling, when you're actually getting ready, you've assessed the patient, you've chosen a product, the patient has agreed to that product, then you need to counsel them on how to take that. Points to include should include that mechanism of action, the dose, side effects, and how to manage. When will it take effect? So its onset. How long until it starts working? Self-monitoring parameters. So how will they know if it's working? Duration of treatment, and then follow-up recommendations. If it doesn't get better, at what point should they go to their provider? You will actually choose a product from the shelf in the Concept Pharmacy to gather this information. So most of our OTC products, because they are over the counter, have this type of information on the packaging. Provide options. So oftentimes we want to provide more than one option for the patient if there are more than one available choices. So for example, if the patient was experiencing seasonal allergies, you could recommend Claritin or Zyrtec, and they could choose based on what they think would work best for them. So provide options for the patient. Again, you will actually be going to the shelf to grab the OTC products that you find appropriate for the patient. Tips for OTC counseling: never give a patient inaccurate information. If you're unsure of the answer, just admit it. It's okay to not know something off the top of your head, especially in this learning environment. Just if someone asks you a question that you don't know, that's a really great question. Do you mind if I take a minute to look it up? So you can have your iPad with you. I'd ask that you try not to rely on your iPad for every case, but for those situations where there's an interesting question asked that you don't know, look it up. Use your resources. I'd highly suggest using resources that you'll have available to you in practice. So our course notes are probably not where I would suggest going, although that's probably the easiest place to find it. Please try and use resources that are available to you in practice. Remember to use layman's terms when you're educating the patients. So this will be something that our actors are really looking for. Oftentimes, that is what I found is our biggest weakness of using each other as evaluators, is sometimes we don't hear those technical jargon terms as actual technical jargon because we are very familiar with those terms. So our actors will be really listening for those types of terms that may not make sense to the general public. All right, we'll talk a little bit about specialty medication counseling. So for example, if you are counseling a patient on a insulin delivery pen, utilize those package inserts. If you're counseling a patient on a new blood glucose meter, utilize those package inserts. If you are uncomfortable with the product, take the necessary time to review the information provided before you counsel the patient. Never guess. Only tell the patient what you know. If additional information is needed, utilize your resources. So there should be package inserts in all medications. Most pharmacies have demonstration kits. You can use computers and iPads and your book references as well. Many specialty medications have videos on the manufacturer's website of how to use them as well. One of the specialty medications that you'll be counseling on this week is Humira. So to prepare for lab this week, I've included a hyperlink as well as an image of which video that I'd like you to watch. It will be the adult self-injection pen, and please watch this video so that you can see hands-on application of how this product is administered. What I would do in practice is make sure that I'm comfortable with explaining how to use it. I would explain the use and demonstrate the use to the patient with a demonstration device, and then I would actually give them materials to watch the video and also printed materials to use when they get home. This is typed up steps of what to do with the Humira. If that is an easier way for you to learn, that's here as well. I'd prefer that you not actually follow through and read these steps, as anyone can read those steps to themselves. It'll be very important that you show the patient how to use it, and then to ensure understanding, ask the patient to demonstrate for you how they will use the medication when they get home. One of the other medications that you'll be discussing with your patients this week is the use of a nebulizer and medications that actually go into the nebulizer. And while it's not common practice that a pharmacist would actually provide the nebulizer, pharmacists do provide the medications that go into the nebulized system. So it's very important that as pharmacists we understand how a nebulizer works and can explain that to the patient, because the medication safety and efficacy really depends on the ability of the patient or care provider to use that nebulizer correctly. So I've provided for you a video that I'd like you to watch. You can access it by clicking on the screen, or also I've provided the direct YouTube link for you as a hyperlink as well. So please take a minute to watch that video and then come back and we'll talk through the rest of the lecture. The tips for nebulizer use are also typed out for you here if you learn better that way. However, as I mentioned with the Humira, it's much better to actually demonstrate and show what you can to the patient rather than reading information to them. We would want to provide them with multiple sources of information, so perhaps a link to the video, printed material, and then demonstration as well. We do talk through nebulizer cleaning and storage. Those may be questions that our patients have that have not been answered by other healthcare providers. So I would really like you to be able to explain that if needed. All right. One of the last topics that we'll be discussing today is medication reconciliation and discharge counseling. So medication reconciliation and discharge counseling are two skills that pharmacists provide in order to assist with transitions of care and accuracy in patient admission and discharge. So medication reconciliation is usually done at transitions of care as well as at every clinic visit. So you may recall at your annual physical, somebody, usually the nurse who's roomed you, will ask you, are these the medications that you're currently taking? Are there others, etc.? And discharge counseling usually occurs when a patient is being discharged from a unit and the pharmacist either A, brings them their medications and discusses them with them, or brings them a list of their medications and discusses them with them. So we always like to focus on these transitions and this accuracy because there is a very large percentage of people have medication discrepancies at their hospital admission. More than half of patients have more than one unintended medication discrepancy. 6% of those have severe harm potential. So it's very important that we address these, and this is a great chance for us to get accurate information from the patient as well as update their medical records as well. The definition of medication reconciliation, let's focus on that first, is a formal process for creating the most complete and accurate list of a patient's current medications and comparing to the list to those in the patient record or medication orders. Medication reconciliation happens in the clinic, in the hospital, in lots of different scenarios. This medication list must contain the name and strength of the medication, the route, the dose, and the frequency of each medication, and then that it should be noted if each medication is scheduled or PRN. Medication reconciliation is performed to avoid medication errors such as omissions, duplications, dosing errors, or drug interactions. And this should be done at every transition of care. This comprehensive list of medications should include all prescription medications plus over-the-counter medications. It should also include herbals, vitamins, nutritional supplements. Oftentimes the things that patients forget to report are prescription or non-prescription ointments or creams, eye drops and ear drops, inhalers, so things that they might not see in their actual medication administration containers. Those all need to be reported for medication reconciliation to be 100% complete. So here's a few steps that I've outlined for you to complete medication reconciliation. So introduce the pharmacist to the patient. So hi, my name is Heidi. I'm your pharmacist today, and I'll be getting an accurate list of your medications today. Verify the patient's name and date of birth. Are you Doris Fritz with date of birth 2/21 of 1955? Great. Explain what medication reconciliation is and why you're completing it. Obtain a list of patient medications from the facility records and then go over that list with the patient. You don't have to start from scratch. You'll be asking questions such as, are you still taking this medication? Is this the dose you're taking? How do you take this medication? Like how many times a day or what time of day? When did you take your last dose? Do you have any other additional medications not on this list, like herbal supplements, vitamins, and OTC products? You'll want to note an indication for each medication. And then after completing the above steps, document the patient's up-to-date medication list in the electronic health record or other record. One thing I'd like to make note of is if the patient has a family member or caregiver with them in the room, it's important that you introduce yourself to both individuals and then ask the patient if it's okay to discuss their medications with them while the other individual is in the room. This is an example medication reconciliation, so this is just a screenshot of what that might look like, so you'll be able to see what that looks like in an inpatient electronic health record. So you'll be able to see that there are options for when was the last time they took it, what time, and then you'll go through and update all of this information. You'll actually be taking notes, probably on a hard copy or an iPad, and then you'll be updating this formally after you've completed your time with the patient. Tips for completing that medication reconciliation: make sure you're knocking on the patient's door and ask if you come in. Introduce yourself and ask the patient if you can ask them some questions about their current medication. If it's not a good time, offer to come back. Maybe they're in the middle of eating a meal, or maybe there's another healthcare provider with them. Maybe they just started taking a nap. And then ask the patient's nurse to page you when is a good time, when the patient is awake, visitors are gone, etc. Explain the importance of medication reconciliation to the patient. This should only take a few minutes. We want to make sure we have an accurate list of your medication so your care team can provide you the best care possible. So those are important things. You don't just launch in with asking, are you taking this medication? When did you last take it? Are you taking this medication? When did you last take it? Establish that relationship. Let them know what you're doing and why. Always remember to foam in and foam out. Hospitals have secret shoppers, kind of, who watch for care team members that miss foaming. Especially with what we're dealing with right now, you will be expected to foam in and foam out of every single station for today's work. In the hospital setting, pay attention to contact precaution signs that require gowning, gloving, or respiratory masks. You're required to comply with contact precautions even though you won't come in direct contact with that patient. So we won't be having any contact precautions in lab this week, but this is something to be really aware of when you're doing medication reconciliation on the floor. For medication reconciliation, there can be some really difficult situations, so use your empathy. Maybe the patient is in a coma, or the patient's family is in a room and is very emotional. The patient may have had 4 other health professionals in their room in the past hour for physical exam, blood draws, PT, etc. Or the patient has not been able to eat for a long time due to an upcoming procedure. So don't rush through a medication reconciliation, even if it's an uncomfortable situation. Verbalize your empathy. There are many different ways to properly complete a medication reconciliation. Go through that current med list and then ask what medications you're missing. You can have the patients tell you their medications if they know them offhand. And some people will have their medication bottles or a medication list with them, so use those resources. If the patient is hesitant on what strength of medication or the name, offer to call their pharmacy and double check. And then ask questions. Use your knowledge of medications to catch gaps in communication and education. If a patient tells you that they last took their gabapentin 4 days ago, ask them why. When a patient tells you that they took their Tylenol last night, ask them how much they usually take and how often. And then remember to ask about commonly forgotten medications. I mentioned a few of these, but those would include creams, ointments, inhalers, nebulizers, eye and ear drops, patches, suppositories, any injectable medications, and then even infrequently PRN medications, even if they're OTC. So this is a handbook that actually has some really great tools for medication reconciliation. So it is a handbook that you can use in order to really walk you through that process. So the URL is located there for you for the PDF. I'd highly suggest saving this somewhere. Page through it before lab this week, and then save it on your iPad so that if you are asked to do medication reconciliation, you can utilize some of these tools that have been created for you. All right, discharge counseling. Discharge counseling is pharmacist-provided discharge counseling can result in medication interventions, improved patient satisfaction, and increases in medication adherence. Reports have shown that pharmacist counseling reduces hospital readmission rates. So that's pretty common knowledge to us. But reasons to perform discharge counseling is to determine the post-discharge medication regimen. When patients are hospitalized, oftentimes they're going home on medications that they've not been on before, or maybe a different strength or a different generic. So those are important things that we as pharmacists need to be involved with. We need to develop discharge instructions for the patient for home medications and then educate the patient. Are these new medications going to be taken for the rest of their life? Are they only going to be taken for a short amount of time? Are they scheduled or are they as needed? The better the patient understands their medications and discharge instructions, the more comfortable they're going to be at home. The most common medications pharmacists are asked to complete discharge counseling on are anticoagulants. So it's very important that you're very well equipped to counsel on those medications. That's one of the reasons why we have these anticoagulations on your consultation assessments for the semester. New medications can seem very scary for patients. Sometimes patients are told they will be or could be on them for the rest of their life. That's pretty scary for some patients. There's pretty big implications for that. Be patient when you're counseling. Look for patients who appear nervous and offer to go over everything again if you need to. Know what you're talking about. If a medication is new to you, research it prior to entering the patient's room. Usually, hospitals will have handouts for patient education. Use them or print what you need. Just don't read them word for word to the patient. And again, don't be afraid to tell a patient you don't know an answer to a question. Ask them to come back with an answer in a few minutes. Use your iPad or your available resources. All right, these are tips from a P4 student. So we will have a P4 academic APPE student with me for the next 5 weeks. So she has provided some tips for you. She said, take this lab seriously. In her email, she stated that this lab has really helped prepare her for the experiences on APPE. And then recognize that your first med rec and discharge education might feel uncomfortable, but that's okay. So don't stress over those awkward moments or mistakes. She guarantees that everyone will have at least one station that they feel really did not go very well, but this lab is meant to help you learn what not to do so you're better prepared in the future. So again, I'm really excited for this coming week's lab. We'll have assigned partners. We'll have a very brief discussion prior to getting started to give you some directions of how to rotate through the stations, and then we'll turn you loose. One of the stations is errors and omissions, and I want to make sure that every group gets through hands-on practice of errors and omissions. All right, thanks for your attention, and we will see you in lab this week. Don't forget to watch that Humira video and that nebulizer video if you haven't already.